Hello there and welcome. Welcome to yet a very, very interesting time on MITV. MITV is here with a health program, a specialized program for the children, which is called Children's Clinic. And on Children's Clinic, we're taking a look at children-related issues from age 0 to age 10. It promises to be very, very educative and entertaining. We'll be taking a look at sundry issues bordering from childhood to childcare, talking about health issues, dental issues, and all what have you. Today we're taking a look at child dental care, and we'll try to find out why children fret when they erupt teeth, and then how mothers should take care of children, talking about diet of children and all what have you. Also on the show, we'll be taking a look at some health tidbits to help you put your life in shape and to make you comfortable even as you nurse your babies. So first, we'll have a break now, and after we come back, we'll be taking a look at some health tips on the show. We'll be back after now.
Dental health care is the maintenance of healthy teeth. It may be referred to as oral hygiene, which is the practice of keeping the mouth and teeth clean in order to avoid dental decay and disorders. Dental health care in children means much more than just having a healthy teeth. It means being free from birth defects such as cleft lips and palates, as well as other diseases and disorders that affects the oral and dental tissues of children. According to the Nigerian Dental Association, the foundation of a healthy permanent teeth in children is laid during the first years of their lives. Therefore, when it comes to the health of children's primary teeth, there's no better time than now to start practicing excellent dental hygiene in children. Children's primary teeth are important. A baby's first teeth is known as its milk teeth and its deciduous. It's usually developed while the children is growing up in the womb. This developmental stage is imperative to a child's future dental health. In addition to this, it is equally very important to establish that a proper dental and oral hygiene is very necessary as a routine for early times in the life of a child. This is to help and ensure that the development of this child is strong and healthy. As such, poor diet, poor habits of food intake such as excessive consumption of sugar-based food and inadequate toothbrushing habits in the first 2 years of a child's life should be avoided, as this could prove to be very detrimental to the overall dental and oral hygiene of a child. Research shows that children who develop cavities in their baby teeth are likely to develop cavity as an adult, so it is very important to get one's child a dentist for checkup. If a child is at risk for cavities, it's time to cut down on starchy snacks and limit sugar beverages. A baby's teeth plays an important role in helping the child do so many activities such as biting, chewing of food, speaking properly. Taking good care of children's milk teeth is essential and cannot be overemphasized. Parents play a crucial role here, as they are key in setting a daily routine for their children, thus making them understand the importance of dental care. The following tips can help children's teeth free from decay and help in cleanliness. Brush the child's teeth for about 2 minutes twice a day. Start brushing the baby's teeth with a pea-sized fluoride toothpaste. Supervise toothbrushing until the child is 7 or 8 years old. Encourage them to spit out excess toothpaste. And finally, taking the child to the dentist when first milk teeth appear. Also do this regularly to ensure that the child's teeth is hip and fit. Taking good care of a child's teeth, mouth and gums does more than help ensure having a bright and white smile. A healthy dental and oral hygiene can improve children's overall health. reduce the risk of serious diseases, and boost the self-esteem and confidence of this child.
Welcome back. I'm sure you have been informed watching that health segment. Now we'll move on to another segment on the show as we'll be meeting with Dr. Olurotimi Olojede talking about child dental care. Please stay with us. All right, welcome again. The program is Children's Clinic, and today we're concentrating on child dental health. And I have in the studio this afternoon Dr. Olurotimi Olojede, who is a lecturer and a consultant at the University of Lagos. Thank you for joining us.
You're welcome, madam. Thank you very much for the invitation.
The issues we're talking about today, talking about dental care in children. Maybe we'll start off by knowing what exactly dental care is in children.
In the child or in children, I want to say that the care, as far as I'm concerned, the care starts from the womb, not necessarily when the baby has been delivered, because some damages will be done to the dentition even while the baby is in the mother's womb if the care at that point is not taken into proper cognizance. And what do I mean by this? For a pregnant woman, it is important for you to realize that what you do even while you are carrying that pregnancy will affect the dentition of the baby you deliver in future. And for that, you want to be very careful as to the medications you take, and also some form of ailment that you undergo as the pregnancy advances. But at the very earlier part of the pregnancy, that will really affect the dentition of the unborn baby. So talking about the care, the mother has to start the care right from conception, when the pregnancy is being carried, and the moment the baby is born. In fact, though that may be for another day discussion, it's even possible for you to give birth to a baby and you have 1 or 2 teeth in the mouth of that baby. It is not really abnormal, but there are things you need to do. You take the patient to the dentist. We take the baby to either a general dental practitioner or those that are in charge of those in pediatric dentistry, the consultant, the specialist in charge of children. They know 1 or 2 to do that. Eventually they'll be able to say whether you retain that tooth or the tooth will be removed at that point in time. Then coming back to the question you asked, talking about oral care or dental care in a child, it starts from the point you want to be sure that even from the point the baby is born, that you want to really be sure that there is nothing really sinister in that baby's mouth. They don't know presence of any teeth, but at that point in time you want to check all the gums, there is no abnormal swelling, the oral cavity environment is really okay without any form of diseases of any kind, swelling or ulceration. Having that, when you rest your mind, and we all keep having that pause until about 5-6 months, when the first tooth, the male teeth, will erupt on the lower jaw, from the lower jaw of the baby. Okay. And the moment that comes, the care starts.
All right. Dentition even while the mother is pregnant, and I think maybe this has to do with the type of food also she takes, apart from medications the mother has taken. Maybe you want to talk more.
Well, that might take us a bit deeper as to how babies or individuals is being formed during pregnancy.
Okay.
All these things, they all happen simultaneously. The crucial time is the first 3 months, from 4 weeks, 6 weeks of the pregnancy. You have, at that point in time, when other parts of the body is being developed, those tooth jam will also start to develop within that period, and so you cannot absorb or stay clear from not taking care of that pregnancy. In taking care of that pregnancy, you're not only not taking care of the mother, but the fetus, and much more than that, all of that developmental process that is going on within the mother's womb. So whatever the mother takes, be it food, be it medication, will affect the development of the baby in the womb, and that will affect the
All right, now let's talk about ailments, that are associated with the eruption of teeth in babies. For example, you see them coming up with high temperature, Some of them are so weak they can't even take anything, they throw anything they take. What precautionary measures should mothers take at this stage?
Babies expressing teething. I want to say that a reduction of those teeth will come with some little inconveniences. I will use that term, that the baby might run that temperature, the stool might be watery, and the baby might not, my baby look not striving the way he or she should. At that period, the baby mother need not to be afraid, what just to treat symptomatically. But when it's getting out of hand, like baby vomiting, trying to put anything stooling, and the stooling does not really stop, it's a bit becoming worrisome, then you need to seek the assistance of pediatrician, and if the pediatrician thinks you need the help of a dentist, they will definitely refer you to a dentist.
Okay. Pastes you need to use as mothers to take care of the child's dentition. You know that for some pastes, some pastes are harsh. What type of paste do you think care? I don't want to concentrate only on paste. Do you think the mother could also use? I know that some mothers use salt, some of them will use just water, and some use paste. Maybe you want to shed more light on that.
What I would normally advocate for is that proper care, as long as you have even just one single tooth in that mouth, that tooth should be adequately taken care of. And for that, talking about paste, there's nothing like ash or paste that you cannot really use in children. Every toothpaste that does not carry the logo of the Nigerian Dental Association, being endorsed by the Nigerian Dental Association, that toothpaste is not fit for the consumption of Nigerians populace. So for that, but what we now advocate is even the adult form of paste could be used for the child. What you just do that on top of that toothpaste, on top of the brush that you want to use in that baby's mouth, just a little size of a peanut will be enough for you to brush the baby's mouth. But much more than that now, I want to say that we have in the market pediatric toothpaste that are designed only for the children. In fact, there are one or two of them in the market that you can get that you wouldn't have any fear of perhaps deleterious or any harmful effects that the toothpaste will cost a child who have such in the market now.
Okay, now you didn't talk about the use of cotton wool and salts. Do you think it is right?
Well, you talking about care or oral care in children, when you have the standing milk teeth, warm water or salt water would not, unless you have a particular ailment that you are now being told, or there is a prescription that use warm water and salt. Outside that, the care for the teeth, what you use is the toothbrush. You have pediatric, you have toothbrushes for children. You have so many of them in the market now, and they are of the texture of the mouth of that brush is soft. So for children it is soft, and with the pediatric toothpaste, they're not harmful. So you can use just the peanut size of the toothpaste of adult toothpaste, or you get the pediatric toothpaste on that toothbrush and use that to clean the mouth of the baby.
Pacifiers and thumb stocking in children, whose teeth are erupting, they have this habit of wanting to have their thumbs in their mouth or using a pacifier. Do you think this is healthy for the child?
It is not healthy, and either pacifier or any form of childhood habit like thumb sucking will eventually affect the arrangement of that child's teeth, and that will require serious dental consultation as the child grows in future. There will be the arrangement of the dental arch. That's when you see the central and lateral incisors being a bit forward than normal, proclinated, and you're having some horrible look that the parent will not be happy with. And for that, to repair that or to bring that back to the normal form costs some fortune, even in the field of dentistry. So it's better in the field of dentistry. So it's better for such to be avoided while the child is growing. So the use of pacifier, top sucking, lip sucking, all those things tend to cause derangement in the alignment.
Even at that age,
in fact, it's even common, and as I've said, as long as you have those male teeth erupting, any habit that a child carries as the oral habit would affect the eruption of those teeth. They will definitely be mal-aligned. The alignment will not be too good. The aesthetics will be affected. Some will be rotated, and with all that, by the time you want to correct it, it's going to cause some for you to get them.
Okay. Now let's talk about children whose dentition are naturally poor. You have some of them looking very funny. Even children who do not use pacifier, who do not suck their gums, you have some funny arrangement in their teeth.
Well, talking about malaligned teeth, that has to do with so many factors. Some of them have hereditary in origin. They have genetically do occur. After that, you don't really have much to do about that. It's just that when you observe such abnormalities in a child, you don't wait until the whole thing is full blown. The moment you notice the abnormality, the moment you notice the dissatisfaction in the arrangement of the teeth, as early as possible, even at age, because by age 2.5 thereabout, a child will have had a full complement of the male teeth, has at least 20 teeth in his mouth. At that point in time, you can really discern as to, the aesthetics is not too okay, and you want to present the child, not until when the child is in the teen or even getting to early adulthood before you start doing something. Or perhaps it is when the child now realizes his self-esteem and they now start disturbing the patient and the parents. That's when you want to come for treatment. At that point in time, you will definitely pay some good money.
Okay, again, let's of the temporary teeth. At a certain stage again, the child begins to lose the teeth. Are there any precautionary measures or special care the parent should administer on the child?
Yes, not on the parts. Talking about precautionary measure, might not really be on the parts of the parent, or what the parents I will advise or employ the parents to do is that they should learn or present their children as early as possible. Don't wait until there is pain. Don't wait until there is a particular complaint. By the time you wait for one complaint or the other, then by the time the child will complain, the problem that will lead to or that will warrant the complaint may have gone out of hand. That you have to extract or remove that particular tooth. And I want that each of those tooths or each of those male tooth help to guide the permanent one. And when they are being exfoliated or removed prematurely, it tends to affect the alignment of the upcoming one. So as soon as you have your child having erupting their teeth, it's very, very important for you to come for what we call routine dental checkup at age 3.
Exactly, I was going to the issue of checkup. Yes. At what age should the parents start taking the child? I will say that as soon as you have those teeth erupting, even if it is 1, 2, you start to seek dental care. Alright, as we wrap up on the show this today, let's talk about how to wash. Parents need to know how to wash. You have a station where people wash up, down, or sideways and all of that. Maybe hear from you now. How exactly do we wash your teeth?
To the care of the teeth. Having said that, you need to use certified toothpaste from Nigerian Dental Association or toothpaste that are endorsed by Nigerian Dental Association with all the emphasis I've made earlier on. I want to assume now that you are using the pediatric toothpaste meant for children, not for adults. If it is for adults, you just use a peanut size of the toothpaste that the adults could use. But if it is pediatric toothpaste, just spread it normally on the toothbrush. And I want to emphasize that the issue of brushing twice daily is also very, very crucial. I want to talk about washing twice daily. It's not washing at 8 a.m. and the second one at 10 a.m.
Okay.
You wash in the morning. You know, I did not really specify my washing in the morning. Yes, but the last thing before you go to bed at night, that will be taken as you are washing your mouth twice daily. And when you've applied the toothpaste on the soft toothbrush for the lower jaw, what you do is you don't brush horizontally. That tends to destroy some hard tissue and also some soft tissue around the gum around the tooth. So what you do is you want to brush like that. That's the way you do your brushing. And as you are doing that outside, you get to the corner of the mouth too. Very, very important. We are fond of just brushing the outside alone, leaving the inward part. You need to do that. You brush, and in the same way you come to the upper teeth and you brush downward. Same way you want to the inward parts of the mouth. Very, very important. And also you don't need to scrub. I need to emphasize that you brush, you don't that you want to scrub. Then you also brush your tongue of the child, not that you want to scrub and just brush gently. You will be alright. And as the moment you have, not necessarily waiting for the full complement, as I've said, as those teeth erupt, bring the child for a routine dental checkup. And the moment you have a full eruption at maybe age 2.5 or thereabout, then regularly every 6 months you want to present the child for routine dental checkup to take care of any complaint, because we have different levels of complaints. The moment the cavity has not gotten to the pulp or to the enamel or to the pulp, there won't be pain. But when it gets to the pulp, the likelihood of removing that tooth is very, very high, or the procedures you are going to do might be a little bit advanced. So following all this, you will enjoy your mouth.
The use of oral mouthwash, will that be necessary for children?
There is no indication for mouthwash, even in adults. It has to be, in this age and time, you just walk up to the store, you pick up the mouthwash from the, and if you think, but I wouldn't want to pass, since I see I'm destroying the market of those that produces mouthwash. Where I'm going is, unless it is prescribed by a dentist, you don't just, it's not necessary, and for a child, unless it is indicated, you don't need mouthwash.
Okay, thank you very much. We'd like to appreciate you for being part of this show this week. In case you're just joining us, the program is Children's Clinic, and we're talking about care of the child's teeth. And we have set this evening. We have Dr. Olurotimi Olojede, who is the lecturer and a consultant at the College of Medicine, Lagos. Thank you so much for your time, Dr. Olojede. Thank you for joining us on the show.
Welcome, madam. Thank you very much.
The program is still Children's Clinic. We'll have a break and we'll be right back. Just stay with us. Well, so much from Dr. Olurotimi Olojede. I've learned a lot. I hope you also learned. I've learned that, it is not a crime to brush your child's teeth with a child-friendly toothbrush. All right, thank you so much for being a part of the show today. I'm sure you enjoyed the program. I learned a lot on the show, and I hope you did. We'll be back again with yet another edition of Children's Clinic, the Healthy Baby's Guide. See you again next week. My name is Jumoke Adiswa. Bye-bye.